My name is Don Self, and for the last 40 plus years, I've been a reimbursement consultant to a few doctors around the country, a few hospitals and office managers and billers and all that. I heard of David Zetter and Zetter Healthcare years ago whenever I was looking for someone as an expert in credentialing, because that's an area I don't get into. And credentialing is a whole avenue where you need a lot of talent and skill and a lot of patience dealing with those carriers out there you're trying to get people credentialed with. And so often practices try to do it on their own and they screw it up, and then they wait until they've been trying for 6 months before they holler at me or someone else and say, "Do you do it?" And I say, "No, but I know an expert who does." And every single time I have referred somebody to David Zetter, they've come back and thanked me every time. At times, a practice will be trying to do it themselves and not be successful, or they're getting the runaround from Aetna, Cigna, United Healthcare, whatever plan it is out there. And they don't seem to realize that whenever they do eventually get credentialed, which may be several months down the road, which is by the way, if you really have somebody doing it who knows what they're doing, it helps reduce the amount of time. They really can't be seeing those patients until then. Otherwise, they're doing services for free. And that's where it comes into play, having the right person doing it. Because I know whenever I say, "Hey, David, how long does Blue Cross Blue Shield give?" And he'll give me a specific number of days, and I know that's true. And, well, "Hey, David, how long until United Healthcare? Can a doctor go ahead and start seeing patients now while we're waiting?" And they'll say, "Well, they have this specific time frame." And you really have to have somebody who knows all the different time frames that I don't know, but he does, thankfully. The nice thing about David is he's not restricted to one area. Even though I've been talking about credentialing and contracting and getting the contracts and everything set up with the carriers and the payers, one of the things that he also does, I know for a fact, is I've seen him and I've helped, not helped, but I've referred him business to him on, is setting up the right kinds of fee structures. It's absolutely amazing how many practices out there are charging less than sometimes what even Medicare would pay, and they're not going back to the carriers and asking for fee increases on at certain times or a certain occasion. He knows how to go in there and do that to help negotiate better rates from the carriers. I've been talking to clients and they'll come back and say, "Hey, and almost really, I can't tell you whenever I've referred somebody to David that they didn't come back and thank me." One of the things about David and his knowledge is he's free to give that information out. Not free, the guy has to pay his bills, has to make a living, but he doesn't restrict clients on how much data he shares with them. So you really need to be finding the right person, be willing to pay the right amount of money up front for them, because if you wait 6 months before you can get on with a carrier because you keep trying to do it yourself, what does that cost you? The loss in that right there has been outstanding. The amount of money I've seen is just amazing that's being lost because they're still trying to do it themselves. Go with a professional. Use somebody like David.